Okay, here I have one of my binders, and in it I have different tabs for the pre-visit, visit 1, the healthcare class, report of findings, and the progressive exam. In each of these tabs I have the different things that we've learned throughout the quarter about each of these different tabs. So in the pre-visit I have all the tips and tricks about what to do before before the visit to get the clients to come in and make everything run smoothly. The visit 1, I have stuff on the yes consultation and the different steps that are taken in step 1. In the healthcare class, I have the different ways that you can do a healthcare class, all the different things that you would want to talk about, and then the different pros and cons to doing the different types of healthcare class. The report of findings shows how to go about making it easy for the client to understand what's going on in the report of findings and how best to talk to them about that. And then the progressive exam, I just have some other stuff that we have learned about the different types of exams and what the patient can expect during those exams. Okay, here is my research binder. In my research binder, I have a bunch of different tabs of different research that I found throughout the quarter. I have tabs on vertebral subluxation, chiropractic development care, functional neurology and chiropractic, current mechanics systems, bad medicine, and new vitalistic healthcare. So in my research binder, I've found a bunch of different research that I've added to this that I'm going to continue to keep adding throughout the quarter. So, for example, in my vertebral subluxation file, I was able to find a lot of different research on how vertebral subluxations affect the body negatively and how chiropractic care can help increase overall wellness. A lot of different studies on that. Wellness development care, I was able to find some research about how getting adjusted regularly can increase your immune system. Chiropractic spinal is just, I put some more research just about chiropractic and the different techniques and how different techniques work for different illnesses and just overall chiropractic care. Functional neurology in chiropractic, I was able to find a lot of research about the different neurological benefits to chiropractic care, such as improving test scores and improving cognitive function. Also looking at the functional neurology technique and using that with chiropractic and the benefits that people can see from that. One case study was about a woman who was supposed to have carpal tunnel surgery on both of her arms, and with a functional neurology strategy implemented with her chiropractic care, she was able to get all of her symptoms taken away, and she's now doing much better. So I have a case study on that in here. Current mechanic systems, I use this just to look at the different systems and put whatever research I could find in this tab. Bad medicine was an easy one to find research on. I did a lot of research about vaccines and the side effects of vaccines, and I put a lot of those articles in here so people can really tell and see some of the negative side effects of vaccines that they are not getting from their medical doctors. And I also put some of the kind of horror stories or case studies in the research that are showing negative side effects of prescriptions, the growing opioid crisis, and things like that. And then new vitalistic system, I just put a lot of research and different things about vitalism and the different things that Life University stands for. And I also added just a few extra research studies that I found, some different studies linking chiropractic care to helping infants with colic and chiropractic care with headaches, things that I thought people would be most interested in that I'll probably put at the front of my binder to kind of feature them. But overall, that is my research binder, and I think it'll be really helpful in my future practice. Hello, Dr. Cottrell's office.
Hi, I was just calling. I actually had a question for you.
Yeah, what can I do for you?
I've been dealing with a lot of lower back pain lately. I started a new job, and a lot of the lifting has been kind of messing my back, and I was just wondering if chiropractic was something I should consider.
Yeah, of course. Chiropractic can definitely help you with your back pain. We have a lot of patients that come into our office with that and have had a lot of success. If you'd like to set up an appointment to talk about your different options and we can kind of get into more detail on what's causing your back pain, our whole focus at our office is to fix what the actual problem is instead of just covering up the symptoms, but we definitely can help you with that. Would you like to set up an appointment?
Yeah, that would be awesome.
Okay, what's your name?
My name is Cameron, Cameron. My last name is Cottrell, Cottrell.
Okay, and did anyone refer you to our office?
Yeah, my buddy Matt actually referred me.
Okay, what is his last name?
Smith.
Okay. All right, what's a good number to reach you at?
989-686-5480.
Okay, great. What's your address?
361 East Lake Place, Marietta, Georgia, 30062.
Okay, that's just some basic information just so we have it on file for you, and then when you come in, we will give you a more in-detailed health document to fill out. So our office hours are Monday through Friday, 9 a.m. to 1, and then we close for lunch for 2 hours, and then we reopen 3 to 6. Would morning or afternoon work best for you?
What days do you have available?
It looks like next week, we have both morning and afternoon slots available on Monday, Wednesday, and Friday.
Okay, can I do a morning on Monday?
A morning on Monday, okay. Does 9 a.m. or 11 a.m. work best for you?
Anything before noon. We can do 9 a.m. though.
9 a.m., okay. Have you been to a chiropractor before?
I have not.
Okay. And you said you were having back pain?
Yeah, mostly in my lower back.
Okay, lower back pain from starting a new job, you said?
Yep, just requires a lot of lifting and a lot of moving around, more than I'm used to.
Okay. Is it just going to be you coming in, or is your family coming in for wellness care?
It's just going to be me.
Just you. Okay. Have you been in an auto accident recently that could complicate or maybe make your back pain worse?
Nope.
No.
Nothing recent.
Okay. If you have insurance, just bring your card with you, and then that way if we have to submit a claim, we can, and we'll just get a copy of that when you come in. If you have Medicare, just make sure to bring all your documents regarding that. Do you have any x-rays within the last year from any other doctors?
No, I don't have any x-rays.
No. Okay, well, once we go over your whole health history, we'll determine if we need that, but I just wanted to double check. Do you know where our office is located?
No, I'm actually new to the area, so I'm not sure where it's at.
Okay, well, it's, do you know where the Big Chicken is?
Yeah, the KFC?
Yep. So we're right near there. You're just gonna go towards the Big Chicken like you're coming from Roswell, and then you'll turn right, and we're right on the left side of the road.
Okay, great.
Okay.
I'll find that.
Okay, great. And then just so you know, when you get here, you can just park right up front. There's designated spots for our patients, so you shouldn't have any trouble finding a parking spot. And then also, just for your information, the first visit will be about an hour. And an option that you have right now is to also book your report of findings, which is just where we go over what we found from your health history and your exams, and then also book your new patient orientation with me right now. That way you don't have to worry about it when you come into the office, and if it's easier for your schedule, we can just plan it that way. If not, after you come in for your first visit, we can book them then. Which one would you prefer to do?
We can just knock it out now.
Okay. So you're coming in Monday at 9 a.m. We'd like to see you about 48 hours after for a revisit. Would you like to come in? Does mornings work best for you on Wednesday?
Actually, afternoons work best on Wednesday. I think you said you had some open.
Okay, yep, we do. We actually have either a 3 or a 5 o'clock.
Let's do 3. I don't want to deal with the traffic.
Okay, 3 o'clock. So that's going to be your report of findings, where we'll tell you everything that we found. And then we do healthcare classes once a month, so that's going to be next week. And you're more than welcome to bring your spouse or any other family member. And we're just going to go over some basics about chiropractic and kind of help you understand it more. So that would be next week on Thursday at 7 p.m. Are you able to attend that date?
I may. Can I get back to you on that and let you know at the appointment?
Yep, that's totally fine. We will see you on Monday at 9 a.m. and we can discuss it then.
Okay, that sounds good. Is there anything else I need to bring besides my insurance card?
Nope. If you'd like to write down any medications that you're on and just get any of your health history or any important documents that you think would be necessary, you can bring those. But if not, we'll have you fill out everything when you come into the office.
All right, that sounds good.
Okay, thank you. It was great to talk to you, Cameron. I look forward to seeing you on Monday at 9 a.m.
All right. Thank you very much. Have a good day.
You too. Bye-bye. Hi, Cameron. Nice to meet you in person. Okay, so today I'm just going to have you fill out some paperwork so you can go ahead and sit over in the waiting room, okay? Okay, Cameron, I'm going to have you read the introduction to the office and then work on your patient history form. Feel free to select any of the options that are applicable to you. And as you can see, it starts all the way back in pregnancy because that's really when trauma to your spine begins, and then it goes all the way up to present day. So be as detailed as you can, okay?
All right, sounds good.
Okay, there you go.
Thank you.
Hi, Cameron. You all set with your paperwork?
I am.
Okay, great. So what is your main concern that brought you into the office today?
I just want to get healthier.
Okay, just get healthier. That's great. A lot of people come into the office just looking to improve their health, so you're definitely in the right place. So let me tell you what's going to happen on your first visit. So I'm going to give you some more paperwork to fill out just so I can get a very detailed health history from you. And then I will review that in detail, and then we'll do an examination, maybe some x-rays depending on what we find. So we'll have you return in 48 hours so that gives me enough time to go over everything, and then I will do a report of findings with you to show you what we've found. And then after we do the report of findings, I will give you a recommendation for care, and then we'll go over that in detail and make sure that everything is going good. And the cost for this visit will be $40. So do you want to proceed with the examination and the report of findings, at which time I'll give you my recommendation for chiropractic care?
Yeah, sounds great.
Okay, great. Sounds good. We'll see you then.
All right.
Okay, Cameron, it was very nice to meet you today. Okay, so I'm going to go over your exams and your x-rays, and I will come up with a care plan that best fits you. So everything that we kind of talked about today, we'll go over more in depth at the report of findings. So you are scheduled 3 p.m. on Wednesday. Does that still work for you?
Yeah, that works.
Okay, great. And then Thursday of next week at 7 p.m. we're doing our healthcare class, and that will help you understand more about chiropractic. So we're going to see you then as well. And then for your bill today, your new patient exam was $25, and then the X-rays were $40. So your total is $65.
Okay.
All right, perfect. I will be right back with that. Thank you so much, and we will see you on Wednesday. Okay?